Hello, I'm Nicolas Girerd. I'm a cardiologist specialized in heart failure, and I am currently in Nancy, France. So I would like to draw your attention on a clinical consensus from EACVI, so European Association of Cardiovascular Imaging, published in July, perhaps when you were on holidays. I hope that you have seen him. I think it's a very important paper because it gives credit to something that is not very used, I think, worldwide in clinical practice, and this is lung ultrasound. So in this clinical consensus, EACVI is drawing the attention on this technique that is in the guidelines, in the last heart failure guidelines, but that is just mentioned in the guidelines. Here you have a very simple message in this paper, basically that an integrative cardiopulmonary evaluation with echo, so mixing echocardiography with lung ultrasound, is probably a good way to evaluate patients with heart failure as well as other patients. So one of the main figures in the article is this combined evaluation of echocardiography and lung ultrasound in heart failure, showing you what we expect to see in patients with heart failure with different levels of congestion. And in a second important figure, there is a very straightforward message showing you what you expect to see in patients with different clinical settings, so with heart failure, but also with shock, with pulmonary embolism, with pneumonia. And so you have a very practical approach to the use of lung ultrasound in clinical practice. So I hope that you will read the paper and it will have an impact on your clinical practice. Lung ultrasound is a very easy to use and useful, I believe, tool. And I am very happy that EACVI is now pushing us toward a better utilization of this very clever tool. And at the end of the article, the consensus document do recognize that we need more research on that subject and especially more trials to ascertain that managing patients with this tool will eventually improve patient outcome. So thank you.